Good morning, everyone. My name is Heather Evans, and I'm the Managing Director of the Community Living Ontario Foundation, and I'd like to welcome you to today's webinar on addressing group health benefit challenges facing the sector. We'd like to extend our thanks to our presenter today, Paul Wheeler from Community Services Benefits Trust, also known as CSBT, one of Community Living Ontario's strategic partners and proud sponsors for many years. Some of you may recognize Paul from our past conferences, as CSBT is the title sponsor of that event annually. We look forward to our continued partnership and this presentation today. But before we start, just a few housekeeping items to run through. All attendee microphones are muted, but we encourage everyone to ask questions to the question panel, and there will be time to work through those questions at the end of the presentation today. We will also be recording the presentation and sharing it later. So without further ado, I'd like to hand things over to Paul to get the presentation started.
Well, thanks, Heather. It's really good to be with you all this morning. As Heather said, we've been strategic partners with Community Living Ontario for a good long while now, for some years, and we're very proud to be part of that partnership, and proud to be able to be supportive of Community Living Ontario and everything you all do. So without further ado, let me start with, here's our agenda for this morning. I'm going to talk a moment or two about why I care about social services and benefits, and then get into supporting employees, because we really believe that your employees are the very best asset of your agency. And we'll go on for there. So let's get going. So who I am, let me start off by saying up front that I am not an insurance guy. I'm an old executive director. My last job before I retired was 15 years of an organization called Semi-House Society in Surrey, BC. And my very first executive director's job was at what is now called Community Living Chatham-Kent in Ontario. So that's the span of my professional career. I've had about 40 years of management in social services in both Ontario and British Columbia, 12 years as a mentor trainer for the learning community for person-centered practices. I'm really concerned for the welfare of the colleagues that I've worked with. I never have felt that they get paid anywhere near what they're worth, and so I've been very concerned to make sure we do everything in our power to support them. So with some colleagues, I was one of the people that formed CSBT back in 2002 when we launched. I was stunned to realize just the other day, actually, that our 20th anniversary is coming up next year. That's quite remarkable to me. So I'm the chair of the board of trustees of CSBT and have been for some time. So let's get into why we think employee benefits are so important. Frontline workers in the community living field really support very vulnerable people, but at the same time, those frontline employees aren't paid anywhere near what they're really worth. The occupations can often be very high stress. In fact, the highest levels of long-term disability and workplace workers' compensation claims in Canada are in the health field and in the social services field. So the stress of these occupations can really lead to some bad ways. So we at CSBT really believe that since these people aren't paid enough and their occupations are really high stressed, at the very least, we need to make sure that if there's a medical event for somebody, that it's covered. If somebody's teeth need fixing, we think that they should be paid for. If one of the employees takes their child into the dentist, we don't think they should have to decide whether they're going to have tomorrow's supper or whether they're going to pay for a filling. It should be something they should ever have to ask. They should just know that it's going to be okay. If somebody gets sick, we think it's important that they can afford to stay home, especially during this COVID time. We all know how important it is that if somebody has a sneeze or a sniffle or a temperature, that they get to stay home and that they can afford to do so. We think it's important that if a crisis happens to somebody that works in this field, that there's proper financial support, or if children need medication, that it's paid for. I travel all over Canada in my role as chair of the board of CSBT, and I meet so many people where they have to decide if they take the child into the doctor and the doctor says, your child needs amoxicillin. They have to decide, well, do I buy the amoxicillin or do I buy tomorrow's dinner? And we don't think they should ever have to ask those kinds of questions. So we as employers buy employee benefit packages. But there's a problem with benefit packages, and that problem's been there for a very, very long time. So I'm just going to use long-term disability as a bit of an example of why we think there's a problem. So if you look at long-term disability from an insurance company's perspective, the insurance company is paid as a percentage of the cost of the benefit. So if the premiums go up, they make more money. So there's no real incentive to keep premium costs down. In fact, there's a real strong incentive to help them going up. The focus of an insurance company when they sell long-term disability is the bottom line. It's dollars to their shareholders, which is fair enough because that's who started their companies. They do tend to adjudicate and manage claims very well, and they provide the basic package. There's no enhancements in their packages. It's just a basic long-term disability package. And if you want enhancements, you have to pay more money. And of course, the worst problem with long-term disability with insurance companies is there's no real case management. Most of them will say they do case management, but it doesn't really start until long-term disability is being paid. And even then, the whole case management is around how do we get the person off LTD rather than how do we support the person. When we started CSBT, we were a group of executive directors, and we thought our approach to the whole thing was different. The concerns that we had as we started CSBT were different kinds of concerns. So our approach was, how do we support employees? How do we keep healthy employees at work? How do we support return to work as quickly as it's safely possible to do so? Of course, we were really concerned with how do we keep costs down, because every dollar that's paid in LTD premiums is a dollar that's not in somebody's pay package or is not being spent to enhance programs for people that need the services that we all provide. So we were really concerned about how do you support the employee and save dollars. Our bottom line for executive directors, we thought, was use the benefits to support enhancement of supports to our clients while also supporting employees. So you see, the executive director's approach to this whole thing is quite remarkably different than the approach that an insurance company would take. So when we were considering those approaches right at the start of the whole thing, we said finally, you know what, we can do better ourselves. So 8 executive directors got together and we formed our own benefits trust called Community Services Benefits Trust, or CSBT. None of us were insurance people. We really didn't know what we were doing or what we were getting into, but we had some must-haves. We said it had to be not-for-profit. We didn't want buildings or infrastructure. We were all volunteers who had our own full-time jobs. We didn't have time to run, or expertise to run a benefits program on our own. We thought the thing should be owned by the member agencies that use the program. So we consider those member agencies to be the moral owners of CSBT, to whom we as a board are accountable. So while it's owned by the member agencies, it's governed by social service professionals, executive directors, HR directors, finance directors, and so on. And we really thought it was important that CSBT should only be sold through trained and certified partners. That's because people that use our services, that use CSBT, really need support and advocacy that's on their side, that's on the employee side. And so that's why we want trained and certified partners. The plan needed to be available fully insured so that there's predictable costs that employers can know this is what it's going to cost me this year, but also next year and the year after, so that they can budget properly. We wanted the program to evolve with best practices, so we thought our board had to be constantly educated so they know what kinds of things to suggest. And we needed strong support for plan administrators, a really good high-end online administration system. And the program had to be very, very flexible so that it could meet different kinds of collective agreements, different kinds of government regulations and group needs right across the country. And of course, it had to have best possible pricing, cost containment. And at the end of the day, what we found was when we really concentrated on that, it gave us huge buying power. So right from the start, we've had this dual focus. How do we provide the very best support for employees while employers are addressing dollar savings? So what happened? We hired an administrator, an organization called Group Health Benefits Solutions, which is now the largest third-party administrator in Canada. Group Health got busy and found us insurance for unusual collective agreement requirements, and we started training our partner advisors. We needed them to understand social services because social services are really different than the local tire company. We think differently and we act differently, and our partners needed to understand that. Well, the program kicked off in 2002, and we grew very quickly in British Columbia. It was so good in British Columbia, we finally said, you know what, if this is so good for British Columbia, it's probably good for the rest of the social service agencies in Canada. So we started recruiting partners in the other provinces. We, right from the start, trained and continue to train our board members to govern and to understand what are the cutting edge things that are happening in benefits around the world. As I said earlier, we started with 8 agencies in 2002. We're now well over 1,000 agencies, and we're providing quality support to over 32,000 employees and their families. So altogether, there's probably about 100,000 people when you include family members on the plan. Of course, those kinds of numbers equate to huge buying power. We're growing and evolving because we're constantly seeking ways to provide more bang for your buck. So I'm going to spend a couple of minutes looking at what I call Benefits 101. So, let's be honest, benefits are benefits, right? Benefits have been really the way they are now for about 60 years in Canada, really no great innovation or changes. A little bit of tweaking here and there, but no real changes in benefit programs. So what we've discovered is benefits are not just benefits. Not all plans are created equal. While basic coverage is basic coverage, we found that we could say, okay, we're going to provide the basic coverage that you've always bought from the insurance company anyway. And by the way, we buy it through insurance companies ourselves. But then we said, what if we provided that basic coverage the employer paid for, and then we added extras at no additional cost? What if the extras made the support better and helped contain the costs? We discovered we could do things very differently with really great results. So let's look at some of that. I talked to you earlier about long-term disability. So we said to ourselves, could a plan do this? Could we buy a basic long-term disability plan for our employees and then add a best practices disability management program onto that plan at no additional cost to the employer? We found out we could. We found out that when we negotiated with insurance companies, they were ultimately willing to keep the cost of LTD lower when we demonstrated to them that right from the 5th day that somebody was sick from work, we were bringing into their life a really good disability management program that helped them to navigate the medical system, made sure that they were getting the support from their doctor that they needed, made sure that any forms that needed to be filled out were filled out, made sure that if there came a time when it was time for the person to return to work or modified work, that the employer was supported to bring them back to work at that time. We did it. We added that program to long-term disability. And at the end of the day, employees and employers are very happy with it. People are properly supported while they're off work. Instead of sort of falling down a rabbit hole, they're really right at the center of their medical situation and really supported in it. We found that people with this program returned to work or modified work much sooner. So of course, less money was spent on LTD. For many agencies, LTD costs across our block didn't increase at all for 8 years in a row. And ever since that time, when rates have gone up across Canada by, let's just say 22% in a year, ours went up 7%. So it's really been effective at supporting employees while also really managing dollars for employers. So we were so successful at that, we said to ourselves, well, what other kinds of things could we do? What are the other places where we could make sure employees are still getting the very best support while costs are managed for employers? So the next thing we did was we targeted the most out of control benefit cost in Canada, which is prescription drugs. This is maintenance drugs, not the kinds of drugs like when you get an infection and you need amoxicillin, but the kinds of drugs where you're taking them over a long period of time, perhaps even as long as a lifetime. We started off by using a plan that uses a central dispensing pharmacy. It substitutes generic or therapeutic alternatives to the drug plan, and it gives the employees the flexibility to choose. We now have, in what we call SmarterX programs, we have a suite of programs that includes 6 different options. And when an employer uses these options, the employee still gets the drugs they need, but the employer saves anywhere from 10 to 25% on their drug spend. So if you realize that about 60 to 80% of extended health costs are for prescription drugs, if you save 10 to 25% of that, you're talking about really significant savings. So those were our first 2, and both have proven extremely effective. The SmarterX programs are optional. You don't have to get into them, but it's really foolish not to because of the huge savings while employees are still getting what they need. So we kept on examining our whole suite of stuff. Working with group health has been amazing because group health has always been very, very willing to say, well, but why does it have to be the way it is? Why couldn't we find another way to do things? And so we've looked at every part of the benefit program, and we're constantly finding better ways to do things that are really different from what's happened in the past. So let me give you some examples. Most of your plans currently have a component called AD&D, accidental death and dismemberment. And the insurance companies pay out very, very little on those accidental death and dismemberment policies because there are so few claims. We don't have AD&D. Instead, we've substituted it with ASI, accident and serious illness. This program provides everything that AD&D provides, but on top of that, it provides a component for serious illnesses like kidney disease, cancer, heart attack, stroke, and it also has a critical illness component that provides insurance for up to 17 other kinds of illnesses that are very common in Canada. We added a stillbirth benefit. I mean, we hate to think about this, but the fact is, dependent life insurance tends not to pay for a dependent that dies if the person didn't live at least 10, 12, 24 hours after their birth. But the fact is, stillbirths happen in Canada. And so, the costs for the family are the same as if the child had lived for a while. And so we put a stillbirth benefit into that component of life insurance. We added a hospital indemnity benefit. This really came about because we became very concerned about when somebody goes in hospital, from the 5th day on, they're paying for things like parking for loved ones that come to visit, or that TV you have to rent for your room, those kinds of things. So we added this $40 per day from the 5th day of hospitalization up to the 180th day. And no receipts required. We just provide $40 per day to the employee or their dependent who is hospitalized. One of the things we also found was frequently somebody is sick, they go to their doctor, let's just say they've got a really bad back. They go to their doctor, the doctor says to them, well, you need a treatment program, but we can't start the treatment program until you have an MRI. And by the way, the wait list for an MRI is 5 months or 6 months or 10 months. So we can't really start your treatment until after that happens. So what we did was, where it's legally possible, because it's not in all provinces, we instituted $1,000 per year toward the cost of an MRI. So that if their doctor says you need an MRI, the person can get it right away. They can start their treatment right away, and that means they're going to return to work much more quickly. We changed the dependent children eligibility part of the benefits program. Typically, it went up to age 24 in the past. We extended that to the age of 26 because the truth of the matter is many, many more children of employees are staying home longer while they pursue higher education. Just like we really knew that the disability management program would really change the long-term disability costs, we also realized that a really high-end, really effective employee and family assistance program would make a real big difference to the costs for extended health. And so we added the LifeWorks EFAP program to the extended health program. Somebody has extended health with us. In almost every case, their employees automatically have access to this employee and family assistance program at no additional cost to the employer. We changed our life insurance program so that people with terminal illnesses can access up to 50% of their group life insurance before they die, because we knew that there are things that families want to take care of, that they want to do in those last months that somebody's alive before they die, things that they want to do to say goodbye properly to one another. So we changed that put in that living benefit. What could a program do some of these? I don't know if you're all aware, but the fact is when somebody signs on for extended health and dental benefits, the insurance company puts a reserve away. That reserve can be anywhere from 8 to 16% per year. They put a reserve away so that if the employer ever leaves that insurance company, the insurance company will be able to pay out any claims that are submitted after the employer has left, during the first 3 months after they've left. We found a way to release those reserves back to the employer, saving them anywhere from 8 to 16% per year. It's called release of incurred but not reported reserves. We also are changing our long-term disability program. Long-term disability typically starts at 17 weeks after somebody is off sick, and it goes for a year or 2 years, and then converts over to the any occupation phase that goes up to age 65. Because of that, the insurance company has to put away huge reserves. So we found a way to change the first part of long-term disability, the part where they're disabled from their own occupation, to what we call midterm disability, which means the insurance company has to put away less reserves. Nothing changes for the employee, but the employer saves huge amounts of money. With group health, the best online administration system in the country is available to every plan administrator at every agency. It's called the WEBS system, and it's a state-of-the-art way for the employer to navigate their whole benefits package and administer it without any glitches at all. We put in place a thing called Benestats, where if an employer requests it on an annual basis, we'll provide every one of their employees with a statement that says, here's what your employer is basically paying you in dollars. And by the way, here's all the other things that are part of your employment compensation. Things like workplace or workers' compensation costs, or unemployment insurance costs, or the cost of the benefit package. All of those things lumped together so that an employee can see what their true package of compensation is from an employer. We found a way for our disability management people to also offer the possibility of doing all of the claims management, the WSIB claims management stuff for the employer at a small price that really enhances the ability to navigate that system well. All of these, or almost all of these enhancements to the program, are at no additional cost at all. And just recently, we've added a couple of new ones, which we think are really important. We're conscious of the fact that many employees in Canada don't have a family doctor. Many people find that if they have any kind of illness at all, the only way they can get seen is to go to the emergency room at the hospital and wait for hours. And especially during this COVID time, it's just not on. People taking time off work and waiting for hours in hospitals doesn't really work for them anymore. So we've added the Akira virtual doctor program to our system, where for a very small fee, an employee can see through their computer, through their smartphone, all of that kind of thing, a medical health professional who will be available to them 24/7. And also recently, in the last year and a half, group health has changed so that all of its claims adjudication, all of its work, all of its access to information about your benefits program is available through one single app on your iPhone or your other phone called My Group Health. And through My Group Health manages the entire claims process and the information process and makes it available to every employee in a really, really easy way. So are we finished? Well, not a chance. We're not finished. We're going to be continually evolving because we have a vision. CSBT wants to be the premier purveyor of quality health and welfare benefit products to community social services in Canada, and we're well on our way. Our vision comes with values, and one of those values is that we have a passion for quality health and welfare benefit products that keep people healthy and on the job, because the people we support in our programs need our quality employees present. We're going to continue to evolve. We're going to continue to find ways to provide better and more for less, just like the people who work in social services. And so we provide educational days for our members. We're constantly trying to find new ways to inform people about what it is they have in their benefit package, how it can really change things. We're increasing training for our partners to ensure they really understand the uniqueness of the agencies that they're dealing with and can provide the quality support those agencies and their employees truly need. And we measure all of our success by how many people are getting better benefits coverage. I didn't tell you earlier about how much premiums we field in a year. What I told you was how many people are benefiting from this really great plan. And that's what we think is the true measure of success. So we're going to keep on going. We believe we're building an excellent person-centered benefits solution for Canadians who support vulnerable people. And we're doing this within the scarce numbers of dollars that are available. So there we are. That's my presentation for this morning. If you're really interested, it's easy to find out more, because if you're a member of Community Living Ontario, you get a weekly newsletter from Community Living Ontario. And right at the very top of the page, you'll see a link to CSBT. Or halfway through the newsletter, you'll see our ad, and again, a link to CSBT. So it's really, really easy for you to click on those links, send in a quick email. You'll find in the information that opens up, it says, hey, send us your information. We'll get in touch with you and tell you more about the program. I've given you the 30,000 foot level, but you can't really understand our program unless you're speaking directly with one of our partner advisors who's an expert in insurance and employee benefits. So let's open it up for questions. I don't know if Heather's still around. Heather, you might come back. I don't know if you've got any questions that you fielded already, but over to you. And thank you for this opportunity.
Thanks so much for your presentation. I just had a couple of questions for you. I know that Community Living Ontario, I've heard Chris say how much he appreciates the SmarterX program. And I'm wondering if you could share a little bit more about that piece of your platform.
Sure. The SmarterX program started off with just one program. It's the one that Community Living Ontario participates in. And it started with a pharmaceutical company in Ontario, actually. So basically that program provides employees with flexibility. So if an employee chooses to be part of the program, the support that they get for their prescription drugs is a little higher than if they choose not to be part of the program. And as I said earlier, what the program does is the person goes to see their doctor. The doctor says, let's just say the doctor says you've got to be on cholesterol medication. You're going to be on it for the rest of your life. Well, instead of the person taking a script into their local pharmacy and waiting for an hour while the script gets filled and buying a bunch of stuff from the pharmacy that they didn't really need because they were spending time waiting for the prescription, instead of that, the doctor faxes the script into the pharmacy. The pharmacy gets in touch with the employee and says, and does any counseling that's necessary, and also says, where do you want to get this thing delivered to? The person says, oh, well, I want it delivered to my work. And the next day, by the next day, sure enough, their prescription arrives at their workplace, by the way, in a plain package with no labeling on it, so that their privacy is taken care of. The employee gets their drugs. When the prescription is about to run out, the pharmacy gets in touch with the employee and says, your prescription is about to run out. Do you want us to get in touch with the doctor and renew it? And all of that's handled for the employee. Drugs are dispensed to the employee directly at their work or home, wherever they want to have them delivered. So the convenience for the employee is tremendous, and the savings for the employer are huge. In fact, with that particular program, typical savings are anywhere from 20 to 25% of the drug spend. So, and as I said earlier, we've got a suite of those kinds of services. That's the best one, but there are several others as well, depending on the needs of the employers and employees. Does that help, Heather?
Yeah, great. That's great, Paul. Thank you. I think just one last point. I believe you mentioned to me earlier that you did a webinar on building resiliency in the workplace and related to mental health issues as well. And maybe you could share a little bit about that webinar and where people might find it as an added bonus today.
Sure, no problem at all. One of the organizations that many of your member agencies would also belong to is an organization called Odin in Ontario. And with our relationship with Odin, we were talking about, especially during this COVID time, how do you keep employees safe? How do you deal with the stresses around what's going on right now? We know it's affecting many people and very negatively in many cases. People's stress has gone up exponentially. In fact, for us alone, with our employee and family assistance plan, normal use of that plan in a given year would be about 5% of employees accessing the plan. And this year it's gone up to 10% and still rising because the stresses are so high. So with Odin, we said, you know what, we need to make something available to people at a layman's level kinds of conversation about how do we support our employees during these really difficult times? How do we take care of the stresses? How do we build our own personal resiliency during these times? And then also, we wanted to recognize that mental health concerns are going to happen and they need to be addressed. And so we put together a webinar that basically addresses all of those kinds of things. It's about a 30-minute webinar, quite easy to see. And it's available to anybody that wants to access it through the Odin website. So all we need to do is log on to the Odin website and seek out the webinar about building resiliency in employees during these difficult times.
Okay, great. We really appreciate that. And I don't think I have any other follow-up questions today, Paul, but I just want to say thank you on behalf of Community Living Ontario for sharing and showing up early this morning for you. I know you're in BC to share all this great information and invite people to contact you. The information's on the screen, but we'll also be sharing the webinar with everyone who has registered as well. So thank you very much, Paul. Have a great day, everyone.
Thank you. Thank you for the opportunity. Have a wonderful day.
Thanks. Take care. Bye-bye.